information. And so, you know, just making sure you get educated, and like I said, you ask the questions that are important. Physical activity, like the young ladies talked about, not smoking. An interesting fact that I found out, African Americans smoke just as much as other people, but we are more likely to quit, believe it or not, during pregnancy, which is awesome. A lot of my, actually, and I see, once I read that trend, I can see that in my own practice. I don't have a hard time convincing my African American ladies to quit smoking. All we have to do is talk about it a couple times, and they're usually pretty good once I let them know the importance of stopping smoking. But they do tend to pick back up after they have the baby, which it's important to continue not smoking, because the smoke gets in your clothes. You think that it's, you know, oh, I'll smoke outside, but it's still on the clothes, it's still on your breath. You go back in, you're in the baby's face, you're kissing the baby's up against your clothing, inhaling the smoke. So it's very important for the well-being of your baby and of yourself not to smoke. Not drinking, everyone knows that you should not drink during pregnancy. People still do it, but I don't think that's as huge of a problem. There are some women that I have that do continue to drink through pregnancy, but it's few and far between. Not using drugs, again, it's kind of like drinking. As far as my patients that are responsible and come to me for their prenatal visits, I have a few that use drugs, but not as many as you would think. Now, there are a lot of women out there getting pregnant who are strung out, and now that's where the problem is. But they don't get prenatal care. They just show up pregnant. They just come in abrupting. That's another big one. You have a woman on crack, she's at increased risk for having an abruption. Do y'all know what that is? So it ties into your hypertension too, because those women are at an increased risk for abruption. What the abruption is, woman comes in, let's say 30 weeks, bleeding from the vagina. The placenta, which is the food for the baby, right? That's kind of how we look at it. That's the blood vessel that's getting blood between mom and baby, has detached from the uterine wall. So now the baby has no supply, right? That baby is sure enough gonna die unless the mom gets in soon enough to be delivered. 30 weeks, that's a premature baby. It's 40 weeks is mature, right? We have an increased risk for that, okay? Because one thing I didn't put up there was we have an increased increased number of women on drugs, on crack cocaine, heroin, which lead to abruptions and other complications in pregnancy. So I'm hoping all of this is making sense and sinking in, but it's all tied together, believe it or not. So getting proper prenatal care and preventing injuries, it kind of speaks for themselves. So my last part, again, I don't want to beat a dead horse. I wanted to give time for you all to ask questions and for you to understand the importance of, not only for us as adults, but for our babies, for our children, for our future. Making sure that we're educating other people. I wouldn't be ashamed to pull a mom aside and educate her, or pull a lady aside, a woman aside, and just educate them on the importance of being healthy all around. And like the trainer spoke on, it's not just physically healthy, it's emotionally healthy, mentally healthy. So any questions for me? Yes, ma'am.
In my experience as a doula and working with pregnant clients and also on the postpartum side, a lot of times it's not the knowledge, like they know I have gestational diabetes, I'm not supposed to drink soda. I understand how it affects my baby, but the disconnect of like letting the information sink in and actually implementing in their everyday life the things that they learn with their doctor, or explaining to someone, you're not supposed to have all these doodads in your crib, and they can recite to you verbatim why they shouldn't, but then you go and you do the inspection and there's all this
Right.
paraphernalia in the crib, and so then you actually have to remove it and show this is the way it's supposed to look. And they're like, oh, or instructing them how they're supposed to prepare the formula,
Right.
and they're putting it in the microwave, even though they know I'm not supposed to do that, and
Right.
explaining to them how to do it. But like, where do you see from like your side educating on the medical side, why there's certain things that are supposed to happen, but then the disconnect from the patient actually implementing those things in their life?
Yeah, I mean, even though I try my best to do a good job of educating my women, some people say I would even scare them. I don't intend to do that. I really just want to tell them the importance of not doing certain things, and it does scare them. Sometimes that works, sometimes it doesn't. And I mean, that's a good question. I'm trying to figure that out as well. I mean, I can get 3 gestational diabetics in a row. 2 of them will do everything I ask, and 1 just won't. And even though I'm telling them all the same information, I'm educating them on the importance of, you know, cutting back on the sugar, 1 just, she claims she just can't do it. So, I don't know. I'm hitting the 2. The 2 over here are doing great. They're doing everything they're supposed to do. They're taking it in. I mean, everybody makes mistakes, don't get me wrong. They have some, you know, drop-offs and things. I just don't know where the disconnect is with this one young lady. And, I mean, it's a good question. I don't know. And I never give up on anyone. So every week I see her, we go over the same things over and over and over again. I always practice with the thought that I'm going to do everything I can to make sure someone is healthy. And if they don't have a good outcome, that way I can't take it personally. Do you get what I'm saying? If I know that I've told this woman everything I know possible to have a good outcome and she still has a bad outcome, then I've done my part. Short of going to her house and being with her every single day, making sure she's doing the right thing. And so that's just how you kind of have to look at it. Just make sure you're doing your part. And every week, I do my part to reiterate. And I get frustrated if she comes back and says, yeah, I ate 5 pieces of cake and 2 Snicker bars and my sugars are way out of control. I tell her again, this is affecting your baby. Not just you, but your baby can be big, your baby can die. I mean, I think there's no other way to put it. You can have a stillbirth. Your baby can have seizures after it's born and die from your sugars being out of control. So you just have to keep educating them. I mean, that's the best answer I have. I don't know. Yes, ma'am.
I was thinking, you know, I think the main thing that would really help us as black women is for us to unify. I mean, it's like everybody's trying to do it in their own little nook and cranny,
Right.
And therefore it's not as significant as if we all united and just made a complete, the fatigues in the army, I'm like, that's real. I mean, we really have to get soldier-minded
Right.
and strategize and, you know, and unify, and then, okay, you tell me what you're doing, you tell me what you're doing.
And come together.
And we come together, and how can we, well, this really works good with my group, this really works good. And then you bank all of that information, and then you find a way to improve upon it.
Right.
And then you strategize, and then you attack.
Well, that's why things like this are important, and she's right. I mean, there's a lot of individual groups that do things like this, and which is great. I mean, I think this is awesome. It's a way to get the voice out there, but it's hard. I mean, it's just like me. This is a separate example, but letting people know that you're here. I have my own business, just like the other young lady, and just getting the word out is difficult. It's not an easy thing. So it's the same with health disparities, the same with health problems. Unless you have something that's really going to reach a lot of people, people don't know. People don't come to the events because they don't know. I mean, we have to have a way to reach masses of people. And the outlets that we use right now, TV and things, it's just not, we're not seeing that positive energy on TV. And that's how people are getting reached. Mass. I mean, everyone watches Scandal, so they're watching the commercials for Coca-Cola and Pepsi and all the bad things that are out there. You know what I mean? Those are the people reaching the masses. It used to be cigarette commercials. You know, you're watching TV, they're getting it out to everyone. That's why everyone was smoking, right? So I think, I just don't know how to fix the problem. Maybe there should be some legislation that we should put healthier stuff on TV. I don't know. Who knows the answer? Yes, ma'am.
I just wanted to say one of the starting points could be with us. We as Black women don't share. We are not transparent because we're afraid of what people will say or what people will do. It's getting better. But if we tell our stories individually to this person, and this person, whether it's health, whether it's spiritual, whatever it is, if we share our stories with each other, and then we can continue to bring it on. And the other thing that I see
with our Black families is that my aunt has diabetes, my grandmother has high blood pressure. It becomes the norm. I'm gonna get it. So there's nothing about prevention. We don't talk about prevention. So we started in our communities, in our churches, and in our clinics, in our birthing centers, educating prevention. I think in those areas we've educated prevention with STDs and pregnancy, but not being a healthier person. So. One other thing, Dr. Crable is an excellent surgeon. I have chronic pelvic pain and had some ovarian cysts and fibroids. I'm a week out of surgery. And I'm here joining you guys today to let you know that if you have those issues, get them taken care of. You don't have to be in pain anymore. So that's added bonus.
That was a plug.
Yeah.
But I'm gonna wrap things up, but I really am honored anytime I'm asked to come do things like this. I know the information can be a little bit much, but it is important that I do my part in educating people. I don't need money to do this, just like the other young lady says. I don't need any of that. This is my duty. This is what God called me to do, and I wouldn't be here if it wasn't for Him. And so my job in life is not for money. It's to glorify Him and to let everyone know that education is the key. We need to continue to search for education and how we can improve ourselves. I mean, I'm standing up here, there's a lot of things I need to do too. So when I educate, a lot of times I'm talking to myself every day. Every day when I'm educating my patients, I'm saying the same thing back to myself. Because I know the struggle. I struggle with weight, so I know the struggle. And I tell my patients, I'm gonna work hard at it just like you, but it is every day I have to tell myself, I need to get up and work out, or I need to not eat this or not do that. So I just say all that to say I want to give back, but I want to give back to myself as well. And so I appreciate Miss Shireen asking me to come. She is one of my patients, just so you guys know. We are accepting new patients if anyone needs a new OBGYN. But no, in all honesty, I really appreciate you all having me here today. And if there's any questions or anything I can do, I'll pass out some of my cards. You can feel free to call anytime.
Thank you so much, Dr. Crandall. Crable, I'm sorry, for coming out. I knew that actually. It is greatly appreciated to have someone to come out and talk to us straight talk. And if anyone has any questions, please feel free to get with Dr. Crable on the conclusion of our program today. If you're looking for a gynecologist, she is accepting new patients. So I'm always a firm believer that it takes a village.
So, you know, please be mindful. If you know someone who needs to be going to the doctor, tell them, hey, let's be a let's be a health buddy. Say, you know, you go with me, I go with you. We keep each other accountable. There are ways. And, you know, if you have, make sure you talk to your family about your medical history, because you won't know to go get the BRAC test or any of these other tests if you don't talk to your family. And you need to have straight up conversations with, especially the females in your family, because generally these kinds of conditions are passed from mothers to daughters. So please be mindful, because I have a lot of female problems and I know exactly where mine came from. So with that being said, we have our next presenter is Shireen King, and she's going to do our presentations for today.
Hello, everybody. It's so good to see your beautiful faces, of course. And I have to say, as a patient of Dr. Crable, she was very kind. She let me know everything I needed to know about my situation. She asked me questions. And of course, me being a talker, I was filling her in quite a bit. And so, you know, but she was very sweet. She was very gentle. I never felt forced or, you know, even though it is invasive, you know, what she has to do, you know, but at the same time, she did it as gently as she possibly could. So it's just an extra plug. But when people do good work, you're going to plug for them, because, I mean, what else are you going to do? You know, you're not just going to stay quiet. You know, especially when we're at a health disparities seminar. Okay, even if you don't go to Dr. Crable, go and get tested, check on your health. My mother was after me for years and I told Dr. Crable this because I was like, oh my God, you know, after I had my son, well, I had lost a baby 2 years after I had my son. He's now 11, and I was like, oh, you know, I feel okay, I'm all right. And my mother was like, Shrey, you need to go, you need to go, you need to go. And she was, I'm sorry, Mom, but you were really on me. And I was like, fine, I'll go. I'll go. And then I was getting hit by some other people. Where'd you go? I was like, okay, I'll go. And Dr. Crable made an easy transition to get back, because I used to go all the time before I had lost the baby. I would go all the time, you know, my yearly and all of that stuff. Then after I lost my baby, then I just kind of fell off the meter. But she made it an easy transition. So thank you. With that, I'm going to start off with our presentations. Anybody here from the daycares? Oh, yeah. I want to just say thank you, ladies, for coming. We had sent out an email to some of the daycares that we knew of, and you know, they're very important. I think a lot of times we just kind of look over daycare providers or teachers, because after the mother, daycare providers are the second mothers to our children. Our children spend more time in the daycares than they do with us if they're attending daycare. So those teachers, they are taking care of our children more than we are. And they're laying a lot of groundwork and things of that nature, and they're, you know, they're educating them, they're getting habits from them. So we really appreciate you, caregivers, because, you know, you're being second moms. When mom is not available, you're being mom. And so we appreciate you. Thank you for coming. Okay, now let's listen to our guests. And so first I'll have to start off with my Dr. Crable, because she's the bomb. I told her about it just in passing, you know, just to let her know that this is something that we wanted to do, and she jumped right on the bandwagon. She, you know, she called me in the process, even up until now. She was like, okay, I'm coming, and I was like, okay. Thank you for remembering, because, you know, you get so busy trying to organize and do things that things are falling off of your list that you want to keep on your list, but it's falling anyway, and she stayed on top of me, and I really appreciate that. Thank you for being such a strong supporter. And so, if you would please come up.